Thank you for joining us today. I am glad to be here with Baltimore City Health Commissioner, Dr. Lena Wynn, Yvette Mingo, Executive Director of the American Heart Association, Mid-Atlantic affiliate, Dr. Shannon Whitaker, Medical Director of the Women's Heart Center at St. Agnes Health Hospital, Sherry, where is Sherry? Sherry Sudano, got it, heart disease survivor and single mom. I think we're wearing matching pins, yeah. She's going to talk about something that is very close to my heart. As many of you know, a key goal of my administration is growing our city by 10,000 families. And in order to grow a city, you have to both attract new residents, but you also, I think most importantly, have to give those residents who are here more reasons to stay. And that means making Baltimore a healthier place to live for residents, both new and old. But across the city, too many people die prematurely from heart disease, particularly our African American and Latina women. In fact, cardiovascular disease remains the leading cause of death in Baltimore City. I'll say that one more time. Cardiovascular disease remains the leading cause of death in Baltimore City. The problem with the acknowledgement of that is that we know that it's preventable, right? So it's not just that it's leading, it's a leading cause of death, but we could actually do something about this. And I know that we can do better. I've never been a mayor that's been complacent or satisfied with the status quo, and I certainly won't start now. This month we have an opportunity to renew our commitment to ending heart disease in Baltimore, and I strongly encourage everyone to show their support for the American Heart Association and wear red on Friday. And I hope that you will join me and hundreds of others across Maryland for the 11th annual Red Dress Sunday at the Mount Olive Holy Evangelistic Church. I think together we can take action and make simple changes towards having a healthier lifestyle. Again, simple changes. No one is saying you have to totally revamp your lifestyle and wake up tomorrow and we want everybody to be vegan. No, but you can do small things to change your lifestyle and change your health outcomes. And when you do it, you have the ability to create that ripple effect for that next generation, whether it is your children or your extended family or your co-workers. What you do influences others. And you can be a positive influence or you can be a negative influence. And my hope is that in this month of February, this Heart Month, that we make the choice to be a positive influence. I know that we can together, not only can we choose healthier lifestyles, but we can also save lives. I know it may seem daunting, but under the inspired leadership of our new health commissioner, Dr. Wynn, I know that we can win these battles, and I know that together we will empower and protect the health of Baltimoreans. I am going to bring up, at this point, our newly minted and signed in and sworn in health commissioner, Dr. Wynn, and I'm going to apologize in advance if I have to sneak out before we're done. I have to sneak down to Annapolis for the State of the State address, but I did not want to miss an opportunity to say hi to my partners as we're working to make Baltimore healthier and helping to reduce heart disease. Dr. Wynn?
Good morning, and thank you everyone for coming today. I always have the unenviable position, I think, of following our esteemed mayor in her comments, and so I just want to say again that we are so fortunate to have a mayor in our city who understands the importance of health to every aspect of our lives, that it's not just let's live healthier lives and let's go to the hospital once in a while for our health care, but rather that this is something we live with 365 days a year, and we have to take care of ourselves because nobody else will be able to. And so we're very fortunate to have a mayor who really understands and is 100% committed to making Baltimore safer and healthier. So on behalf of the Baltimore City Health Department this morning, I'd like to welcome everyone to the kickoff of the American Heart Month to talk about a serious silent killer in our community and what we can do about it. And as our mayor very well said, This is the #1 cause of death in Baltimore City. And it's an issue that is something we can do about today. That this is not someone else's issue, it's our issue that's affecting ourselves and our families. You know, I'm an ER doctor, and I'd like to share the story of one of my patients to begin today. Mary was in her late 40s. She worked as an office manager and was the mother of beautiful 12-year-old twin girls. Mary thought that she was pretty healthy. She never went to the doctor because she thought she was in good health, and though blood pressure and heart disease ran in her family. One day she woke up with some nausea, some stomach cramping, and some chest pain. She thought that this was indigestion and took a Tums. She called her sister, who just thought that she didn't sound quite right, and her sister rushed over to her house. By the time that she found her, Mary was barely conscious. That was how she came to us in the ER. In the ER, we found out that Mary had had a massive heart attack. The major arteries in her heart were blocked. While we were preparing to get her arteries opened, Mary's heart stopped beating. We resuscitated her for over an hour, but were unable to save her. These are the stories of my patients that I will never forget. I will never forget Mary's last hour. I will never forget the suffering of Mary's family. I will never forget that Mary died from a preventable medical problem, heart disease, that is the #1 killer of women in the US. It's the #1 killer of women right here in Baltimore City, and of men in Baltimore City. Right here in Baltimore City, heart disease kills 30% of all of our women, more than strokes, breast cancer, and lung cancer combined. Now, we all know that heart disease is a problem, and we all know what contributes to heart disease. High blood pressure, high cholesterol, diabetes, these lead to heart disease. Underlying these issues are obesity, lack of physical fitness, and smoking. For us to reduce deaths due to heart disease, we have to fix these underlying problems starting today. Under the leadership of Mayor Rawlings-Blake, we at the Baltimore City Health Department have a number of initiatives that address fitness, healthy eating, and healthy lifestyles. For example, our Be More Fit for Healthy Babies program offers group exercise classes and advice on food preparation every week at 3 locations in Baltimore City. Our virtual supermarket program works with low-income residents in food deserts. Residents are able to order their healthy and affordable food online and pick it up at multiple community virtual supermarket sites for no delivery fee. These are just some examples of programs that we have that focus on prevention for cardiovascular disease. So I want to offer a couple more ideas for what you can do today to improve your health. First, we have to keep our kids healthy. Nearly 1 in 4 children in Baltimore drink soda every day, and less than 1 in 5 children eat their recommended fruits and vegetables. Now, that doesn't seem to be the right ratio, right? We have to change this, and we have to start promoting healthy lifestyles in our children. Second, start small and set clear goals. As our mayor said, these are things that you can do today. We're not asking you to change your whole lifestyle overnight, but rather set clear goals that can have enormous impact. An example, replace your 12-ounce can of soda with water every day. This can save 51,000 calories every year and a loss of 15 pounds just by saving on soda consumption, which isn't good for anyone. And take a 30-minute walk during lunch. That can make your meetings walking meetings. If you do this 5 days a week or even 3 days a week, that's aerobic exercise multiple times a week. Third, stop smoking. Remember that smoking contributes not only to heart disease, but also to other killers like cancer. We in the health department and in the city can offer resources to help you quit. This will really save your life. And after just 1 year after you quit smoking, you reduce your risk of heart disease by half. Finally, know that any of us can be at risk for heart disease. Many women, like my patient Mary, never thought that they are at risk. Women also tend to downplay our symptoms. We're used to taking care of ourselves or taking care of other people and not ourselves. So make sure that you get screenings for blood pressure, cholesterol, and diabetes, and know that heart disease is often a silent killer. So don't wait until it's too late. Get screened and get healthy today. Throughout this month, we'll be working with partners like the American Heart Association and St. Agnes Hospital to encourage residents to keep healthy, set goals for food and exercise, stop smoking, and schedule regular screenings. The American Heart Association is the force behind National Wear Red Day, which unites women and men across the country in this national movement to encourage women to give them a personal and urgent wake-up call about the risk of heart disease. So to tell you a bit more about National Wear Red Day, I am very pleased to introduce Yvette Mingo, who is the Executive Director of the American Heart Association, the Mid-Atlantic region. Yvette?
Good morning, and thank you very much, Dr. Wen. I thank you, and to our esteemed mayor, thank you for your commitment to health, overall health, and in particular cardiovascular health for Baltimore residents. As the Executive Director of the Heart Association, we are always excited to be here in this conversation. We're excited about the last 11 years of the Go Red for Women campaign nationally, where women have been fighting collectively and individually to raise awareness around heart disease and stroke in women and to empower ourselves. So in these last 11 years, I'm so pleased to say more than 620,000 women's lives have been saved. That's fantastic, but the fight is I know it is great, right? But the fight is far from over. Each year, as Dr. Wen said, it's our leading cause of death. 1 in 3 women dies of heart disease and stroke. But we can change that because, as you're hearing, 80% of this is connected to controllable factors. So with greater education and some lifestyle changes, we can prevent a lot of these cardiac events. Now, in those 11 years since 2004, when we started Go Red nationally, we have had almost 1.5 million women join us. 1.5 million women have registered for Go Red. And 9 out of 10 of each of those women, when they sign up, they actually begin to take actions. Small actions, as Dr. Wen said, but actions to empower themselves and get healthier. So whether it's eating better, exercising, changing their diet, they're doing it. And as we know, as women change, so too do their children. So we're excited about that. But Go Red isn't just about individual or family decisions. It's also about women empowering other women to take control of our health. That's the mission of Go Red. And why does it matter? While heart disease is still the #1 killer for us and also Baltimore City residents, we've made some progress around stroke. So nationally, since 2011, stroke has dropped from the 3rd leading cause of death to the 5th. So from 3 to 5. These stats are so attributable to the courageous people, patients, survivors, healthcare workers, government people, volunteers like myself, and professionals who are fighting stroke. But the stats also tell us something else, that lowering death rates in cardiovascular disease is possible and it is happening. So, as Dr. Wen said, there's some things we can do. She gave you an amazing list, so I only have 2 things to say. And that is, first, let's lead by example. Let's lead by example. Let's know our numbers, as the good doctor said. Let's make sure we exercise a little bit. Let's eat a little healthier. And second, let's spread the word. Find 5 women you love. 5 women you love, and ask them to change their lives with you. Encourage them to join the National Go Red movement. Tell them to go to goredforwomen.org and get the resources and information that we have. On Friday, February 6th, we are again celebrating National Wear Red Day. It's crucial. Wear Red Day is about visibly showing that we're in the fight for women and cardiovascular disease. That's why it's so important. We can't stop this #1 killer just by spreading the truth. On the 6th, please look for lots of buildings to Go Red, as well as people. Now, when I say buildings, I mean like the World Trade Center, the Rolla Seltzer building, etc. We're excited. We have many of our news anchors, business leaders. I'm sure Dr. Wen will be joining us on Friday going red, including over 50 hospitals, thank you, St. Agnes, local news anchors, and legislators. It's important. As we raise the awareness, we shift attitudes and we expand minds. Our national sponsor, Macy's, will once again offer 20% discounts, so get your shop on this weekend. Just wear your Go Red penny pin, any Go Red, Wear Red dress pin, and get your 20% discount as you think about your health and shop. Lastly, I just want to say congratulations to the 140 additional Maryland businesses that are downloading our resources through the Go Red campaign locally and spreading that to their employees. We hope you are amongst one of those 140 companies, but if not, remember to go to gored.org. And if you're here, come check out our table. We thank you, Dr. Wen. We thank the mayor. Have great. It's my pleasure now to introduce my colleague in the fight, Dr. Shannon Whitaker, Medical Director from St. Agnes Hospital.
Thank you, Yvette. Thank you, Dr. Wen, and thank you to Mayor Stephanie Rawlings-Blake. Thank you for your commitment every year to having this press conference and reminding the citizens of Baltimore that heart disease still is the biggest killer in our city and the biggest killer of women. So I appreciate your commitment. Another sign of Mayor Rawlings-Blake's commitment I heard on the radio this morning was providing tax breaks to grocery stores that are going to set up in so-called food deserts. So really the commitment is there. She's really, putting a commitment behind her words to make sure that there's access to healthy food in our city. So you've already heard about statistics. You've heard about how prevalent heart disease is in women. It's the biggest killer of women in this country, in Baltimore City. Cardiovascular disease kills 1 woman every minute in this country. 1 woman every minute still. The latest statistics just came out in December, published in the American Heart Association's journal, and it still has that alarming rate. Maryland still has a long way to go in improving our death rates to cardiovascular and coronary artery disease. We're 31st out of 51, including the District of Columbia, in terms of death rate from cardiovascular disease, and 38th out of 51 in terms of death rate from coronary artery disease. So we still have a long way to go here, and that's why we're continuing these efforts. One thing that St. Agnes has been doing in the same exact time frame, actually, that Go Red has been going on. This is our 11th annual Red Dress Sunday. And it started in 3 churches 11 years ago. And the emphasis is to have congregants wear red to their houses of worship on Sunday, this year Sunday, February 8th. It's the second Sunday in February every year, in order to increase awareness about heart disease in women. And we focused on African American churches and now to Latino churches, because these populations are overrepresented in our numbers of people with heart disease, are really hit much harder than their numbers in our population. And again, it is so preventable, and really just educating and increasing awareness can make such a big difference in the rates of disease in these populations. This year, Mount Olive Holy Evangelistic Church will be our media church, and we'll join 180 other churches in our area and in several other states in having Go Red festivities. And they include devoting part of the sermon to a heart disease presentation, either from a survivor or from a medical professional, talking about different risk factors, having health fairs after the service, and other activities to increase awareness. So we're just so blessed that so many have joined our efforts. When I joined St. Agnes in 2011, one of the things I wanted to do was help the spirit of Red Dress Sunday, which is so inspirational, and the spirit of Heart Month, which is so inspirational, and keep that going all year round. And as Yvette mentioned, and as Dr. Wen mentioned, it's important for women to get screened, to get checked out in some way or another. Talk to your primary care doctor, talk to family members who have medical knowledge. But one thing at St. Agnes that we've offered and developed is our Women's Heart Center, which I have the privilege of being the medical director for. And we've developed the 60-minute heart check, which is a screening program, 60 minutes for $60. We started out with it in May of 2012 as a program for women. We're now opening up to men as well. The focus has been on women just because the awareness, still has a long way to go. But we offer for $60 a 60-minute visit, which is a consultation with our certified cardiovascular nurse, a series of screening questions on a questionnaire that allows each person to have a personalized risk factor assessment, and then other items such as blood work, cholesterol, and blood sugar measurements, as Dr. Wen mentioned, an EKG, blood pressure, weight, and waist circumference measurements. And all of these together will give each person who comes for our screening a picture of what his or her risk is of having heart disease. And they leave with an action plan, because there's so much that we can do to affect that, as has been mentioned already here today. So I close by mentioning that, as well as our Red Dress Sunday website, www.reddresssunday.com, and our St. Agnes website, stagnes.org, which has a wealth of resources. You can make appointments for a screening, but also there's lots of links to other resources about heart disease. And I invite everyone here to take a look at that, as well as consider coming in for a screening. So again, I appreciate the Health Department, Dr. Wen, and Mayor Stephanie Rawlings-Blake for their commitment to this cause every year, and I appreciate the opportunity to speak. And now it's my pleasure to introduce Sherry Sedano, who's a heart disease survivor and Go Red ambassador, who probably has the most powerful and captivating presentation today, telling us her story of heart disease. Thank you.
Good morning. Thank you for having me. As Dr. Whitaker said, I am Sherry Sedano, and I am a heart survivor. Last year, at just 44 years old, and with no previous health issues or warning signs, I was diagnosed with coronary artery disease. I know what you're thinking. I know what I was thinking. I don't fit the normal stereotype. I started with chest pains, I started with heartburn and indigestion. It bothered me. I did what most of you would do. I ignored it. I took some antacid and hoped it would go away, but it didn't. The pain got worse. So I went to the emergency room. They ran some tests, and from there I was sent to Johns Hopkins for a cardiac catheterization. I was told I have had a 95% blockage in my main artery. It was not what I expected. A stent was inserted, and in 5 days I was back at work, and by all accounts, I was fixed. But then, just 5 months later, the pains were back again. I went back to Johns Hopkins for another cardiac catheterization, and I had another blockage. This time, it required a double bypass. Again, not what I was expecting. Again, my life was turned upside down. But, as you can see, it was another successful procedure. I was lucky. I went to the doctors, I was treated, and I walked out of there without having a heart attack. Heart disease runs in my family. My father is also a heart survivor. He had bypass at 48. His mom, my grandmom, had a heart attack at 40. Although I knew this, I never thought I had to worry about my heart. I was healthy. I exercised. I didn't smoke. What did I have to worry about? Unfortunately, having a close relative who has heart disease puts you at a higher risk for cardiovascular disease. This experience has been eye-opening and has changed my life forever. It has been a tough year, but every day gets a little bit better and I get a little bit stronger. Sharing my story helps. What I want to tell people now is to listen to your body. Know your risk and don't ignore the signs. I listened. I knew something wasn't right, and catching it before I had a heart attack made my recovery so much better. Luckily for me, both of my procedures went well. I had great cardiac care and support from my family and friends, which I know makes a difference. I will be monitored for the rest of my life, but with medication, exercise, and a healthy diet, I will hopefully live a long, heart-healthy life. Programs like Go Red for Women are created to raise awareness, to tell people that 80% of cardiac events can be prevented with diet and exercise. Also, heart disease is not just a man's disease. 1 in 3 women die of heart disease and stroke. I know how important it is to share the message and is why I'm here today. My message to you today is to listen to your body, know your risk, and know your family history. It can save your life. Thank you for having me.
That really was the best for the last. Not to say anything about our mayor and everybody else who came before, but I think that what Sherry just described is, it's such a personal story of how heart disease is something that affects each of us. And we didn't do this at the beginning, but I bet had we asked everyone to raise their hands, if you know someone in your family, among your close friends who's been affected by heart disease, I bet that all of us would raise our hands. And yet, unlike cancer even, or unlike many other things that we talk about, we just don't think about it as something that we can do today. So thank you for sharing your very personal story, Sherry, and thank you to Yvette, and thank you to Dr. Whitaker for being such amazing partners in our efforts with the American Heart Association, with St. Agnes Hospital. I know that we're very much looking forward to the National Wear Red Day and also to the Red Dress Sunday going on this week as well.